Hey, it's Dr. V, your favorite psych NP. So I feel like I have a unique perspective because while I was going through my HRSA loan repayment, I got fired and I had to find another HRSA approved facility. So I wanted to share that story and hopefully give hope and also give you a little bit of options when you're looking for school loan repayment. All right, so number one, what are these programs anyway? They're funded by HRSA, which stands for Health Resource Service Administration. And basically, they give you a scholarship to work in rural areas that are underserved. And you make a commitment to work there for 1, 2, or 3 years, and you get a certain amount of money. For me, particularly, I did a 2 year contract with the State Prison of Arizona, and that was for 50,000 for me. Midway through my contract, I was terminated, so I had approximately 13 months left of my contract. So that's where I had to scramble and find another site that was HRSA approved. Once I found my site, I had to, or a site that was HRSA approved, I had to apply, get the job, go through credentialing. That took like 3 months. And then finally, once that happened, then I could submit to HRSA that I was actually transferred and that I worked at that position. So it extended my time on my contract because I wasn't working for approximately 4 months during that time. So overall, I really wanted to just share that it is possible if you do get terminated through your contract. The only thing you're gonna have to worry about is looking for another site that is HRSA approved. And for me, I got lucky that another HRSA approved facility was within 40 miles from my house. But I have heard of stories where people have to commute 100 miles one way to go to a HRSA approved site. Also, if you factor in, the money and the repayment that you get, it can be potentially worth it because for 2 years you get 50,000, and potentially if you do 4 to 6 years at one facility, you can renew these contracts and you can get all of your student loans paid, assuming that you work there for 4 to 6 years. I think one of the misconceptions for myself that I had was the waiting period. So when you apply, there's a window that basically goes on to next year. So you kind of waiting around to see if you get approved. And the contract commitment starts the day that the money is dispersed. So for example, I think the application closes in September and you don't find out till February of the following year if you're going to be awarded the money or not. And then you actually get the money in September of that year. So that's when the actual 2 years starts. So essentially, you're going to be working there at that facility for like a year doing that role, apply, see if you get it, and then you'll know if you get the money or not. And then that's when the 2 years start. So you could potentially sign up for a 2 year contract, but you'll really be working 3 years. Now, don't get me wrong, I think it's a great program because it incentivizes people, nurses, providers to go work in underserved areas. I definitely don't think they should be given to the prison. I think they should be given to more community mental health clinics than the prison, but that's just my personal opinion from what I've seen within the prison walls. As always, thank you for watching, thank you for listening, and if you have any HRSA related questions, please don't hesitate to drop them in the comments, and I'll see you on the next one.